everybody, and welcome to Bad Ideas, the show where we look at misfires, mistakes, and miscalculations from all throughout history.
I'm Tony Southcott.
And I'm Albert Berg, and Tony has our bad idea for the week. Tony, what do you got for us?
We're going to be talking about thalidomide today. It's a drug developed in West Germany by the Grunenthal Company in 1957.
I was getting a little bit nervous about the Germany thing, but it is after the Troubles.
Well, you'll see some things that kind of relate back to the Troubles, but we'll get there.
Okay.
Anyway, thalidomide was what a lot of doctors had said was an answer to a prayer. It was a miracle drug that would go on to sell more over-the-counter pills than aspirin in a lot of countries, especially in Central Europe. It was sent to anyone needing a sedative, a cure for insomnia, gastritis, tension, anxiety, nausea, and most specifically, nausea caused by morning sickness.
Now, morning sickness, for those who are really, really out of the loop, is the sort of nausea that you get when you're pregnant, right?
Yeah, it doesn't necessarily have to hit in the morning, but for a lot of pregnant women, it hits. You're throwing up all sorts. It's a terrible, terrible time, and it's one of the harder ones to actually get a good treatment for. It seems like you kind of just have to suffer through it a little bit.
Well, so this gets rid of nausea. I can say, as someone who's dealt with some people with nausea recently, that sounds like a good thing, Tony. What's the bad idea?
Well, it caused massive birth defects.
Okay, yeah, that's bad.
Yeah. I'm not talking about little ones. The most commonly known defect associated with thalidomide was phocomelia, which basically is the Greek word for fin. It makes shorter arms with sort of like fin-like appendages if the kids are born with appendages at all. Lots and lots of kids were born without ears, born without arms, legs. Over 50% of the people that were that had used thalidomide with this, their kids would end up dying before their first birthday.
You know, I'm a little bit familiar with this case, and I know about the missing limbs. I did not realize that the mortality rate was that high.
Yeah, and basically it would cause entire organ structures to be deformed. Whatever could go wrong seemed to go wrong, and we'll get into a little bit of what happens, what the mode of action for that is later. But it was just horrid for pregnant women, and these companies just promoted it specifically to them whenever they only did testing in mice beforehand.
That is the bad idea to me.
Yeah.
Maybe check out how it works with the people first.
Yeah, that's a little bit important. Let's take a step back and look at how this all came to be. Grunenthal was set up as a soap company after World War II to help fight the need for antibiotic materials and other substances in West Germany. Heinrich Muchter was appointed to head the discovery program based on his experience working with the German Army's antiviral research program. In the course of preparing reagents for the work, Muchter's assistant isolated a byproduct. It was recognized by pharmacologists as an analog to glutamide, which was also a sedative, so they thought that they had kind of stumbled on to a new type of medication that was very close to another one that they might be able to sell based on some of the other things that they were working on. After a little bit more work, they decided to turn the compound into a suitable drug, and that was called thalidomide.
Now, I'm not fully understanding the path here to... like you said, they tested it in mice. They originally think it's a sedative of some kind. How do they figure out what it does and at least the initial properties of this drug?
Well, they did test it on several types of animals, mostly on different rodents. And after they did about a year of testing, they moved on and brought it as a sedative to market, not over the counter, as a prescription drug. But on October 1st, 1957, because of how effective it had been, and basically there were a lot of scientists making claims that you could feed as much of this drug as you wanted to a rat and you couldn't kill it. Like they considered it safer than aspirin for a lot of these different things, and it became just a straight up over-the-counter drug called Countercan, and it was used to treat insomnia, coughs, colds, headaches, all these different things, and people thought it was amazing and they were selling millions of tablets of it. At the time in West Germany, drugs only had to be tested on rats before being sent to market, even though the regulatory agencies in East Germany, Soviet East Germany, denied approval of the drug because they knew that the analog glutamide was known to absorb vitamins and cause deficiencies in children.
I wanted to mention also that we're at the point now where we're finally starting to realize that rats are not people. Like they're different, guys. Like they're useful for like, will it kill you just as a biological organism, but they're not exactly the best sort of test subject for things you want to go on to use in humans. And yet because they're so cheap, we continue to use them a lot. Maybe that'll be a future episode of Bad Ideas.
Yeah, possibly. It's also interesting because so much of our nutrition information is based on rats and we have completely different systems than them. So there's a lot that can be learned from them, but not near enough to say anything with certainty until you get to actual human clinical trials. Anyway, eventually 37 companies under many brand names were selling thalidomide in countries all over the world. In the UK, it was generally sold under the brand name Distaval by the Distillers Company. Their advertisement claimed that Distaval can be given with complete safety to pregnant women and nursing mothers without adverse effects on the mother or child.
Just goes to show you they can just print whatever on a package. Buyer beware.
Prior to this, actually, John F. Kennedy had been trying to make it so that the FDA had more powers. Last week, we talked about clacker balls and basically how the FDA had they had some newfound powers whenever they were going after people that they didn't have prior to this. And thalidomide was actually one of the reasons why they gained more authority. While all this is happening, Kem and Grunenthal turned their gaze to the United States. After being rejected by Smith, Kline, and French, along with many other companies, they reached an agreement with the William S. Merrill Company. They went on to produce more than 2 million tablets, anticipating that the FDA would approve the drug quickly. A Canadian doctor named Frances Oldham Kelsey began working for the US FDA. It was her first case, and her superiors wanted to give her like a really easy drug to kind of learn the process and just get it approved quickly. But Frances Oldham Kelsey did not rely on the information from the company because William S. Farrell sent basically a pamphlet saying all the things it did, but they didn't send any test results. And she was very, very skeptical of this, so she actually forced them to start doing results, or to start sending results. And because they couldn't actually prove that it made people drowsy, she made them keep submitting and keep submitting and keep submitting until some other doctors were able to prove some of the other terrible side effects.
So they were still selling this as a sedative.
Yeah, they were selling it as a sedative and anti-nausea, all these other things.
And yet they
didn't have evidence for it.
It didn't actually make you sleepy.
No, they were giving people many times, sometimes like 6 to 10 times more the dose than was required for a sedative according to what was on the bottle, and it wasn't making people tired. And because of this, Dr. Kelsey was very staunch on being like, if you're going to make these claims, you have to have evidence for it. And props to her and the people that worked at the FDA at the time. Her superiors were all over just letting her do this her way. Like, they saw that she was doing it very analytically and very evidence-based and decided to just let her run with it.
That's awesome.
Because everybody thought it was just going to be a slam dunk. They were just going to prove it like so many other countries had done because it was such a popular drug at the time.
I have a question, and maybe this occurs later. Did it actually prevent morning sickness?
It did. It actually did help with nausea at a very severe cost.
Okay.
At this point, a single scientific paper from the UK shows that there might be permanent negative neurological defects, and Oldham Kelsey wanted an explanation for this. She asked for more testing, and even in the face of dozens of other countries approving this, Dr. Kelsey held her ground and prevented thousands of potential birth defects.
Yeah, this is part of the story that I knew about ahead of time, and it's worth noting this is a very famous failure of the drug companies, but it did not actually come over to America. No doctor was ever legally allowed to prescribe it in this country, so we dodged a huge bullet over that.
Yeah, I was reading that there's only been about like 17 to 20 cases, and some of those might have been just standard genetic defects that were caused by thalidomide in the United States compared to the 5,000 in West Germany and the other 5 to 20,000 around the rest of the world. While this was happening, Australian obstetrician William McBride and German pediatrician Wildken Lenz suspected a link between birth defects and the drugs, a later Lenz proved in 1961. For her services, Frances Oldham Kelsey would go on to win the President's Award for Distinguished Federal Civilian Service, which is a little bit of a mouthful, by President John F. Kennedy. And this is the highest award that a member of the U.S. government can actually receive. Since she was a civilian and not a military member, they couldn't give anything higher than this. She had a ceremony where she met the president, and he was actually able to parlay this into some legislation that made it so there would be stronger restrictions on prescription medicines in the U.S. He was having trouble getting that through until this thalidomide thing hit, and the news was all over it. They were showing this giant crisis that was averted because the FDA was able to take a little bit more time doing their due diligence. And that's part of the reason why, even though today it can get kind of cumbersome, it's still very necessary to make sure that these companies aren't just trying to pull a fast one on people.
And I'm sure Keme Grunthal, being the fine, upstanding, and responsible citizens of the world that they were, realized that they had a terrible drug on their hands and that they were hurting people, and they bowed out gracefully.
Not really. Keme Grunthal was not very happy about this. They went on the offensive to try to prove that the drug was safe, citing chemicals in the water, nuclear fallout, and a myriad of other reasons why these birth defects could happen. Members of the company were put on trial for negligent homicide in the 1960s, but ultimately no one was charged. A class action lawsuit was placed against them that netted about $100 million for a foundation to help the victims of thalidomide, and it got up to about $320 million due to contributions from the German government. But because of all the people that were affected and the cost of lawyers and everything, this accounted for less than $25,000 per person that was actually alive to receive the benefits. And as you can imagine, for lifelong medications and therapies and everything else, that does not even cover a tiny bit of what they had to deal with.
Not to mention the people who lost their kids within the first year, as you mentioned.
Yeah, there's a lot to handle here, and basically no one got out of this in a good way. Interestingly enough, part of why they didn't have any statistics on these birth defects was because Germany was a little bit reluctant to categorize hereditary birth defects, because during the Nazi regime they had mass sterilization programs for anyone that had kids that had birth defects or were suspected of possibly having them, and they were trying to distance themselves from that, so they didn't even want to keep records of when kids were born sick.
Interesting.
In 2009, the Keme Grunthal company would issue a formal apology to the victims for their drug and revealed a moderately distasteful statue in their lobby as a way to remind them of their past mistakes. Advocacy groups called this too little, too late, considering it was 50 years after the fact.
What is this statue you speak of?
It's basically just a thalidomide baby crying in bronze. Or not bronze, in some sort of metal. If you want to see this, just Google thalidomide statue, and it's some of the first results that are there. It's the bronze one, not the marble one that's done with a little bit more taste.
So, Keme Brunthal's, still around?
Yes. They are still making medications. They've changed into, it's Grunenthal GmbH now.
Okay.
So they are still making medications. They're still producing, penicillin. They are still actually producing thalidomide, along with some other medications.
I was going to ask about that. What happened to thalidomide?
Well, after all this happened in the 60s, thalidomide was pretty much banned worldwide. There were a few countries that just kind of took a hands-off approach and didn't end up banning it. Well, so far we haven't really talked about why thalidomide causes so many birth defects, but it seems to start with the inhibition of angiogenesis, which is the body's process of creating new blood vessels. It stops or slows the progression there, sometimes entirely cutting off things. Bodily organs wouldn't be fully formed. However, there are a lot of conditions, such as with tumors and things like that, where you wouldn't mind if the blood vessels flowing to these certain sites were actually cut off and the genesis of those was stopped. So some doctors, starting with leprosy and moving on to various other things like macular degeneration and various other cancers and tumors, found that under very restricted conditions, they could still use thalidomide to combat these conditions.
Now, there was something that I don't know that I fully understood. Thalidomide, obviously dangerous for babies in development in the womb. Is it also dangerous for fully grown adults who are not pregnant women?
There are a lot of different conditions where it could be bad. It seems like it has some neurological defects over time if you're taking a lot of it. Say you're one of the people like me who's taking quite a few Advil every day. If you were taking it for something like that, over time you could develop some problems in the brain, some problems in the heart. Or if you had an injury and your body had to do that angiogenesis to heal, you would have some problems with that. So it was somewhat safe for normal adults to take it, but you also have to keep in mind that it can be transferred through bodily fluids, so sperm and various other ways are a way of transferring this thalidomide to other people.
Okay.
So, you have to be under very restricted things. If you currently get prescribed thalidomide, women have to go through monthly pregnancy tests and various other things. They have to be willing to literally accept an abortion if they've been on this and decide that they're going to basically not use protection.
Oh, wow.
Yeah, it's a very, very regulated thing from the FDA because it causes so many problems so quickly. It gets through that placental barrier that blocks a fair amount of drugs. But to be honest, we actually don't know which drugs will often get through that barrier, partially because of thalidomide testing. Because of this sort of testing, we stopped testing a lot of drugs on pregnant women because we didn't want to see what the side effects were.
This is an interesting sort of perverse side effect of trying to protect people. They passed regulations making it much more difficult and increasing the... It's not that it's illegal to test things on pregnant women, but they ratcheted up the difficulty. They said you have to meet a much more stringent requirement if you want to test your drugs on pregnant women in the US at least. And the companies essentially decided that it wasn't worth their time to figure out those defects with all those extra regulations on them. So they essentially just stopped testing things for pregnant women.
Yeah, that's why most drugs will say do not take this if pregnant or nursing. And with that, there are about 12 total medications in the United States that are approved for use during pregnancy. So it's pretty low, and it's an odd thing to stop it, but it's pretty easy to understand why. There's not many people that are going to want to put their child at risk doing clinical tests for pharmaceutical companies.
But if I will say there's also, if there are mothers who are going without medicine and putting themselves at risk, that could create a much greater problem.
Yeah, I was reading about a lot of different conditions. Like I have an autoimmune disease that if you're on this medication while you're pregnant, they don't know exactly if it's going to pass through the placental barrier or not. Like it's an immunosuppressant in different ways, so that could end up being horrible for the baby, but they haven't really tested it out. They don't know if it'll actually do anything with that.
I have read that they're trying to make things a little bit better on this front to encourage more testing in pregnant women, but it is a tricky subject.
Yeah, especially because more than 70% of pregnant women are on at least one prescription medication. It's interesting, like the trade-offs that we have with this, but in the end, I think it's if it's not going to adversely affect your health to the point where you're not functional, it's always going to be better to have like a natural pregnancy. Maybe not always, but it's generally going to be better. Even with that, like it's great to see that these regulatory agencies actually were able to kind of step up and do their job, even whenever they didn't have the full authority to just go out and take these out, like on an international level. Because of the research of people like Frances Oldham Kelsey, we were able to prevent a lot of children being born with birth defects. And it's just interesting to see how much it's changed. Like, we're looking at a 10-year approval process for a lot of medications, and that's really hard whenever you've got a long-term condition and you just want new medications to be put out. But really, if the effects are going to be like this, where you end up having children that are born with basically, like in the description, like the flipper-style arms or like missing toes or having like 8 or 9 toes on each foot, like you really got to be a lot more careful with it. Like, you need that time to put out a medication. And this is coming from a guy who's mostly libertarian.
It's a really tough trade-off, I gotta say. I don't feel like I have... I could come down on... I could make arguments for both sides of the case, and I just hope that medicine continues to get better. Well, I think that'll do it for this week. Kind of a bummer topic, Tony. I talked about clacker balls last week. Why couldn't you just have toys? They're not bad ideas that kill babies.
Yeah, I tried to, and I was like, just do thalidomide this week.
Don't put this on me. If you have thoughts or questions or suggestions, you can first of all reach us at our Twitter. That's at Human Echoes. We're also on Gmail over at badideashow@gmail.com. And that will do it for this week. Thank you guys so much for listening, and we will see you next time, maybe with something a little bit less of a downer.
Yeah, have a good one.
Bye.
Bye.